in the Department of Health and Sanitation, we've just picked a sample of them just for this presentation, but we have the write-up and more details about the same. So this is Kapchebar dispensary. This is in Tambach ward, and just to say that there's no money that has been allocated there, but this is the current state of the disposal site, which is not fenced, it is not dug well, and some very bad, harmful waste are being disposed at that facility. So maybe because there is no incinerator, there is nothing, and arrangements for taking this these wastes is not properly done. So the health department kindly address the issues of health.
I want to make the difference between a panning chamber and an incinerator. First, we don't have an incinerator in our county. We all have panning chambers, including the 10-county referral. So an incinerator it has very advanced features, whereby the materials involved, we have engineering bricks, the iron bars are very advanced, and also it is as the temperature which is being regulated. It burns at high temperatures. But our panning chambers, we use the local materials, and we don't have control the temperature of it. And also because the cost of an incinerator is very high, in our facilities we have sorted to the panning chamber because of the workload. We don't have that big workload that it can force us to use an incinerator. But soon, maybe we are going to have one at a 10-county referral. So first of all, I want to start with Kapcherop. As I've said, we had engaged the team earlier. The incinerator, the panning chamber at Kapcherop is at 90% complete. We are just left with painting and sorting area of the waste. So we are almost done, and very soon that facility is going to be put into use.
This is an incinerator, and I said this is a reflection of all the incinerators in our county. So we want to really say that from our assessment, this may not qualify as an incinerator, but a burning chamber. So we may need to seek some clarity on what we call an incinerator in our county and what should be a burning chamber, because this is a reflection of what is in Tambach, what is in Iten, and many others. Because as we are allocating resources in our ward or in our wards, the public are now saying we want an incinerator. And if this is an incinerator, then we must say this is not the one. Then we need some improvement on the same. We have other dispensaries in Kapiego and others which the state is just this way. Especially in issues of like, for example, this toilet, the first one here, this other side belongs to Kapchebar dispensary. Although there is no money, I want to say there is no money that has been allocated, but then there's need for something to be done. Then the other one there on the other side is a sinking toilet in Chesongoch. That is Chesongoch public toilet, which was constructed by the county government, and it has never been opened up. It has never been opened because it is already the other side. It is already sinking, and it is in a very bad state. Although ukiona nje, we have the photos here. Ukiona nje ni mzuri sana. This is Kawapsos dispensary. It is up the hill. Kawapsos is just here in Tambach. But that is not the case because this was constructed under money by CDF. But in the year 2018-2019, there was an allocation for money to put up, to install electricity, 100,000 in this facility. This is Kewapsos in Tambach ward. To allocate, there's need to have electricity, because currently what is being used there, the fridge and other things are being powered by solar or gas that was donated by World Vision. And the members of the public allocated money in 2018-19 for electricity, and nothing currently is going on. So and electricity is very important for this facility, for the cases of drugs that that need to be preserved in a fridge or any other thing. So that dispensary needs to be urgently installed with electricity.
Kewab source electricity, we have transferred the funds to the facility, and we are only waiting for Kenya Power to make the installation, and that one will be sorted out.
Has the facility paid Kenya Power?
It is in the account of the facility. So then maybe the next, there is an engagement between Kenya Power and our department. So that the only remaining portion is maybe to make the payment and they come and install.
Then there was the issues of Kocholwa and Tot mortuaries. In Kocholwa, there was an allocation in the financial year 18-19 of 2 million for the members of the public still believe that they had proposed for a mortuary in Kocholwa. In the records, it is written upgrading of Kocholwa sub-county hospital. Then there's no clarity on what that improvement means and what the members of the community proposed, because currently there's nothing that is there. Then also in Tot, we saw an allocation of 300,000 for mortuary shed, but currently Tot has do not preserve bodies. So that is something that we may need clarity on the same also.
Kocholo mortuary, we have some land issues between the facility and a local church. There's a church which initially they were owning part of the facility, and the dispute has extended to the involvement of the land commission. So up to date, the settlement is at advanced stage, and it's our hope that once that dispute is sorted, the issue of the mortuary will be dealt with. Tot dispensary, this is a project for 16-17. Project for 16-17 financial year. It is true. We had problems with that mortuary, and the problem emanated mainly from the design. I think initially in those past financial years, the communities were allocating money, not having the cost of the construction in mind. But as a department, through the public participation, we have been able to engage the communities and give advice as to what they are supposed to build. And also, we have given out an advice that it is better to allocate one project and then complete, or if it is not complete, the design can be put even up to halfway so that they can source for other money for completion. So we thought mortuary, we had design issues. And what we have done, because we had engaged the team, is that the current one, we are going to convert into something else because it cannot fit to be a mortuary. The space, the working space where the bodies are preserved is not sufficient enough. So we have temporarily converted one of our buildings in Tot and used the machine which is there. And as a department, we are sourcing for additional funds and put a standard, a design of a mortuary with the assistance of the Public Works Department. Kaptiabar dispensary, with a project on septic tank. It has been done. The only remaining part is the drainage, the drain pipes between the facility and the septic tank. So hopefully very soon we are going to wind up with that one, and the facility will be put into use. So as I've said, since we have had some engagement with the CSO group, we have done a lot of sensitization on funding of our health projects. Two, previously, our projects were not being approved by all the relevant departments. But from this year, in fact, the CS has given a directive that from this financial year, all projects, all county projects has to be approved by the relevant department, so that when there is an issue, we are able to notice very fast. And also, the design, we have also advised that plans should be drawn having the site in mind, because previously we had plans which were drawn and implemented uniformly in majority of the areas. But we found that as a department, we had some challenges in terms of the geographical area and the topography of the place. So through our representative who is dealing with public works and our department, who is Mr. Chamweno, they have been able to address those issues so that we don't have the same plan being applied in many areas of the county. And also, as a stop-up measure, through the engagement with the CSOs, every ward, all projects, not health projects alone, all county projects are being monitored by our ward and the locational public health officers. So everybody's jurisdiction, everybody is responsible for all the projects in that area. So they have been able to monitor from the handing over to completion. That is why we don't have much problem at the moment. From 17, 18, 18, 19, we have never had issues with our health projects because our public health officers have taken responsibility because of that fast engagement. And I think also His Excellency the Governor had instructed in one of our meetings that there should be no people moving from county to the rural areas when we have the staff who can supervise from there. So we have totally engaged them, and they are being monitored by the sub-county public health officers. So currently, we don't have much problems on the monitoring of the projects.
What measures are you putting to ensure that all boundaries are marked and, if possible, all facilities are given title deeds? Because you find almost in Leland, almost every facility, some you may not know even the boundary, unless upate ile mzee wa zamani mwenye alikuwa hapo anakuambia ilikuwa inafika hapa. What happens wakitoka?
Why is it that you are adopting one structure? If it is a structure for a building, you adopt it uniformly in the almost all wards. Why I'm raising this issue is because of this concern. For example, in Kapsawar ward, we allocated 2 million. You are giving us a structure worth 1.5. Why? And we allocated 2 million for that. Because we have specific. Why wanted the 2 million structure, not 1.5?
Incubators of Kwajalwa Sub-County Hospital. It was alleged that it was brought to Iten referral and was meant to be returned in 2 weeks' time. But up to now, they have not reached to where it was meant to be.
We have some facilities whereby the contractors just go there, they start their work without even involving the management of the hospital or the PMCs of the ward, or even the charge in us. For instance, we have Kapkesumu dispensary. A contractor went there, started his work without even involving the nurse in charge. The nurse in charge was only told to come and sign the payment vouchers, and even she doesn't know how many the bill of quantities. First of all, she doesn't have the bill of quantities, so the contractors go to the crowd and then they start their work without the involvement of the community. Thank you. On issues of sanitation, disposal pits, as we've seen at Kapchebar dispensary, what are the measures that you take so that, for as we had raised, those dangerous materials like used needles or gloves, which are so it's hazardous to the community or the environment, what are the measures before they are taken to Tambach sub-county? As the duration zinakaa huko kwa muda, what is your take as for them to transfer them to the nearest facility? Kama itaenda kuchomwa ama itafanyiwa namna gani?
There was a plan for Sangurur dispensary. Was it Sangurur? Yes. And the structural plan for the dispensary, the cover page is written Sangurur dispensary. But the inside page actually is for Kapkesum. And funny enough, it is written Kapkesum dispensary in Kamarin ward. So maybe if you can explain.
My concern is on dispensary in Katalil in Kamarin ward. Katalil dispensary is under construction, and in some few months ago, we were given some equipment like beddings and so forth, but the ministry is requesting that the construction first of all be finished. So I don't know which measures or which way did you use so that you bring us first of all the equipment before the building is finished.
Okay, thank you very much. Mine first is a compliment to the Department of Health. You're really doing a good job. Na tunapata services mzuri sana kwa hospitali, especially our county referral. Juzi hata nilikuwa na emergency kidogo, na wakati tulipeleka kijana alishughulikiwa mpaka mimi nikasikia kupiga simu kupigia gavana kuambia asante sana. So only niko tuna concern moja ambayo is very genuine observation ambayo nimeangalia kwa county referral, na unajua Elgeyo Marakwet hatujazoea jam sana, and the users of hii barabara ya kwenda Bugar, hii highway, siku hizi kuna kuanga na jam ambayo sometimes hata juzi last week nili have kuweka emergency because somebody was so emotional. Hapo kwa moja hapo kuna gate imefunguliwa hapo, so somebody was so emotional akarash akiwa analia anataka kuingia kwa gari yake, na akaingia hata ajui ni barabara ndio ana cross, so nika break na ilikuwa tu ni Mungu. So tunaomba ile solution ambayo nataka kupropose, kama itakuwa tu ni entrance alafu magari itogezee huko ile nini ya quarter sio mwisho wa lami hapo, so that we avoid this jam yenye inakuanga hapo kwa wakati wanachukua mwili. So hiyo ni concern yangu na nafikiri kweli tuangalie hapo. Asante sana.
I understand that the facilities always request funds from the NHIF when a mother delivers. So I want to understand, when the facility receives the funds, they are required to transfer to the revenue kitty, and then they come back to the department to request for the same money. When they come back to request, this money usually takes a lot of time to go back to the facility. I would like to know, is that the process or what is the process?
I will start with the issue of the boundary. Most of our health facilities have been built on land which has been donated by the community, and some are in the forest. What we have done as a department is that we have engaged the people who donated land. They are either individuals or members of a family. So we have identified those other ones. We have marked. We have started marking. We have engaged the owners, and they have now shown us the portion of land that they are supposed to give us. Though we have been having also issues with some people, like Sangurur and I think Aptarakwa, whereby there were some people, there was this allocated land. Then the youngsters are now, maybe they think that there is money in the county government. They want to say this was our land and we want to be paid. But the boundaries, it's ongoing. We are really serious on that one, because also county funds, we don't place where there are no title deeds. It's getting us some issues. So we are really working to see to it that we secure our boundaries of all the land that we have been given. Also, we have engaged the forest department. All those facilities in the forest, health facilities, and I think the same problems is with the Ministry of Education, because they have some schools. We are engaging them with a view of having those areas degazetted so that we can be given the title and be able to better develop those areas. Because currently, there is some issues where we don't have that free hand to work. Another one is there is this issue of same design. It is true. Personally, I have visited Sangurur, and even the contractor was having some issues. Tendere was having issues with Sangurur. Personally, I engaged the committee, and there is some understanding. They could not understand why that plan was saying a plan for Kwambabelio and not Sangurur. So we have corrected, as I had said earlier, so that we can have our specific plans for that specific area. Because it's very difficult to convince Wananchi that whatever you are being given is the right thing. And also, when it comes to the area, the design has to differ from one point to another, so that we don't get substandard buildings. On the issue of disposal sites, being a county government who is progressing and growing, we have tried our best to have some panning chambers in most of our facilities. And where we have not been able, we have dug a compost pit and fenced, so that we burn some of our combustible waste in those ones. But the syringes and other medical waste, we normally, there is those safety boxes. I think you have seen some safety boxes here you're gonna hold it over. So we normally have those ones. We have a system called infection prevention control. If you go to a facility, there are some plastic containers marked differently with different colors. So we classify our waste and put those ones. So with the medical waste, we normally take to the nearest facility with a panning chamber. We have been doing our best, and we have never had issues. Even our private facilities, like the one, some in Iten, they bring to Iten county referral, whereby we charge a small fee for those services, just a small one, because at least when somebody comes to your house, you should take some responsibility. The incubators, I think there was an issue. We had a lot of small babies being born in Iten or at Flani. So we had to rush to our sister facilities, like the one we had mentioned, to borrow the incubator. But I want to say we are sorry as a department because we have delayed to return it. It is clearly your thing. So it is us, we will do it very promptly. We are taking that plan. But I would like to ask you that whenever we come around, like even trucks, we do some redistribution. So once there are some items which are not used on the other end, we can always rush to take to another site where there is shortage. And then later on, we return to the original point, like fridges for immunization. That's how we normally do it. Construction without involving the management committee. I think we have done this. All construction sites, the facility must be given all the drawings and all the plans. And then again, we have trained the health management committee, and they are very much aware that before commencement of any activity, they have to be there. And I think the CEC and the CEO have been going around, and they have been meeting them. So I don't know, maybe if there is a place, Jamono, do you still visit a facility and start work without engagement of the management committee?
The in charge of health projects. Nowadays, we don't hand over site without the involvement of the management committee. In fact, the chair of the facility is the chair of that project. All the progress from handing over site will be the chair, and the other committees will be our people at the ground who will be overseeing those projects from the start to the end. So maybe that allegation from that facility, you will tell us which financial year was that, so that we get to correct.
And also we have a witness, Transparency International. They have been assisting us in training the management committees. And those are the very components that they are supposed to have on site. Everything is placed at the facility, a copy of everything. And also there's a site book, construction site book, whereby even the members of the public can go there and make some comments, so that when the project management committee or some inspectors from the county go for inspection, they can always read those comments, they check, and if there is need for action, they take action. And even the contractor I know who is doing the construction, unless even the chairman has been very active in our meetings. So I don't know if there is a lapse anyway, but he is totally involved. And if there is an omission, I'm sure he will be able to take responsibility, and the staff who are there.
The chair of the hospital management told us that they all realized, they all knew the contractor when they eat the cake, the dispensary cakes. But the management themselves had no any information on what they were doing on the site. And because they were only seeing that they had come to assist them, they say that they didn't mind to ask them what they were doing, that they were doing their own work without the involvement.
Is it the one for septic tank?
Septic tank,
Yes.
Yeah. I was even there the other day. I was with the ward public health officer. And I know that thing is not even complete up to the standard there. But that was part of the correction that we met.
The issue is, was the nurse in charge involved and the facility manager?
Yeah, they were involved. Unless they are not, because that's a very open thing. They were involved. And even I remember even the governor, when we were going for the maternity, we were with some members of the public there when we were going around Kapchemutu Ward. So maybe, Madam, I'll have that need to really confirm, because I was there 2 days ago, and I met the sister. Maybe I'll really confirm and if possible give you a feedback.
So I want to give a general communication and information pertaining NHIF refunds. Usually when the patients are treated at the hospital, they have two options. They either present an insurance and or pay in cash for those facilities which we charge, especially the sub-county hospitals and ICRH. Mainly our citizens use the NHIF card. And when they present the NHIF card, the patient is treated and discharged without paying as per the policy. Once the money is recouped from NHIF, because the facility charges now NHIF, NHIF disperses the resources or the funds through the facility account. PFM requires that the money is not spent at the source. Thus, the Public Finance Management Act does not allow expenditure at the source. So the money must be banked to the County Revenue Fund account, and this money are claimed by the specific facilities through the Department of Health. And mainly, we encourage them to claim them on quarterly basis. However, we can pay them on need basis. These funds are budgeted in the budget as an appropriation in aid called FIF. For the last financial year, I want to say that we had budgeted a total of 37 million. We dispersed everything in totality. The balance was 0. This financial year, 19-20, we have budgeted 60 million. And I believe when the department puts forward any requisition for disbursement, we are going to disperse them. Currently, we don't have any requisition at finance department. We usually take approximately 1 week to be able to reimburse back the facilities, the funds, directed to the facility accounts. This is for the reason that we must do the requisition through the approval at the Office of the Control of Budget. Specifically to the question which was raised, the free maternity funds, which are due to the facilities once we have mothers delivering in those facilities. Those funds are supposed to be expended directly by the facility so that we don't have any delays. But I'm aware, due to the budget impasse we had recently, some facilities utilized the free maternity funds which they had been reimbursed to address other emerging issues, in the hope that when the FI funds are dispersed, they were going to replenish the maternity kit. So these funds, they are utilized for purchase of those delivery kits which are issued to the mothers when they go to deliver.